It's been 4 years since the COVID-19 pandemic made its way to Kentucky. And although the number of cases has dropped significantly, data shows there's still been a recent uptick in ER visits and hospitalizations.
Kylie Hill explains what those numbers mean in our top story at 6:30.
If it seems like everyone is getting sick these days, there may be some truth to that. Kentucky's Cabinet for Health and Family Services data shows there have been 438 hospitalizations due to COVID-19 this July, which is up from 292 in July 2023.
Over the last probably about 10 days, we've jumped into the 15 to 20 in various stages of either sick or in the process of recovery or fully recovered.
Although COVID has never fully gone away, it does bring up concern when cases become more prominent, especially with the new school year underway.
We actually expect to see quite a bit more over the next few weeks. So making sure that folks, especially those that are higher risk, are up to date on their vaccination. For many, that has slipped their mind because we haven't seen huge numbers.
But why does COVID seem to pop up at random times throughout the year? Well, there are a few reasons.
The virus is not done with its transformations and growth. There was an expectation there would be a summer surge based on the development of different types of strains of COVID-19.
The virus is still serious, but thanks to vaccines and more information, it's become more manageable, which means hospital capacity isn't as much of a concern as it was in 2020.
Emergency departments and hospitals have plenty of capacity. They're not hurt by COVID. The incidence or the number of new people with long COVID is decreasing.
It's an age virus, meaning very young or very old people are more likely to have a harder time to recover. So best practices are to wash your hands and avoid others if you're feeling sick.
Don't put others at risk just because you feel like you need to be there. Make sure that you're thinking about yourself, your health, but also the health and potential risk to others.
In Lexington, Kylie Hill, Fox 56 News.